Good morning. It's brilliant to be here this morning, to see so many fantastic people in person and so many people that I know are so passionate about social prescribing and have devoted their life and careers to making this work. And it's phenomenal to see so many people that have really made social prescribing happen right across the country. And to those of you online as well, thank you very much for joining. I know, looking at the list of delegates, that everybody does fantastic work in this area. And I wanted to start off by just saying an amazing thank you to you all, because what we've achieved over the last couple of years in bringing social prescribing into the fore, in enabling it to be part of the mainstream healthcare system, is fantastic. And that is down to all of you and the many, many people that are working every day, day in, day out, to change lives through social prescribing. I just wanted to thank Elaine for her fantastic words. It's fantastic to be here, an organisation as NASP in the Southbank Centre, in partnership with the organisation that's doing so much work. And it was great to hear Elaine's list of fantastic programmes that the Southbank have got coming up over the course of the next year. So why social prescribing then? Why is it important? You know, why do I think it's important? Well, Professor Sir Muir Gray says that it's easy to be healthy and well. You just have to be born in the right postcode area, you have to have the right amount of money, and you have to have the right genetics. That's it. You know, if we fail at that, then, you know, there might be a problem. But if we can all achieve that, then we're going to be fine. So that's easy, isn't it? We also talk about lifestyle, don't we, and behaviour choices. We talk about ill health and we say, well, people haven't adopted the right lifestyle, they haven't adopted the right behaviours. But actually, isn't that wrong? Isn't it wrong to think that in this country, people that are born in the poorest areas will develop a long-term condition 10 to 15 years earlier than those in the most affluent areas? And they may well die 10 to 15 years earlier as well. Now, that's about postcode. It's about level of connection to society. It's about money, and it's possibly about genetics. But we know those factors are hugely detrimental to our health. We know that the social determinants of health are much more powerful than the biomedical approach that keeps us well. Biomedicine's fantastic. You know, we all need drugs. Drugs are fantastic. And we know that with the demonstration of the COVID-19 vaccine. We've seen the massive transformation that vaccination has made across society. So biomedicine's still going to play a role. And if you look at what's happened, the advancements over the last 100 years in medicine, it's been amazing. You know, it was less than 100 years ago that we discovered penicillin. That was 1924. And you look at what's happened over the scope of the last 100 years with advancements in medical practice, you know, the ability to x-ray somebody, the ability to do an MRI scan, the ability to transplant hearts and lungs in human beings is phenomenal. And we know that those things are really important for health, not just in this country, but global health. However, because of those social determinants, because of the issues that we have in society, we know that biomedicine isn't going to be the only answer. We know that it has limitations. We've seen through the Chief Pharmaceutical Officer's recent review in over-medicalisation that 1 in 5 people over the age of 65 that are in hospital not because of the condition they're living with, but because of the medications that they're taking. We also see that pharmaceuticals are damaging to the environment. We see that they create harm to the biodiversity of the planet. And actually, we know that there are limitations. We see issues with addiction to opiates, to painkillers. We've seen the National Institute for Health and Clinical Excellence, NICE, recently say that actually exercise can be more beneficial to people than taking opiates and taking other forms of painkillers. We also know that there are issues in society with things like antimicrobial resistance that's creating the resilience of viruses, the resilience of bacteria, and really reducing the benefit of biomedicine. And we know that 1 in 5 people going to see their GP today will be turning up to their GP with a social need, not a medical need. They'll have an issue with housing, with relationships, with debt, with social isolation and loneliness. We also know, when you look at the NHS, that 40% of people say they lack the skills, knowledge and confidence to manage their long-term conditions. 40% of people also say that they're not involved in their care as much as they would like to be. And 40% of people say that they do not have the ability to understand information that they're provided with by the NHS. So actually, if this is the environment that we've got, if we've got a society that has so much inequality built into it, if we've got a system where, whilst biomedicine plays an amazing role, we've also got issues with its limitations, this is why we need social prescribing. And I think that case is no stronger than it's ever been. I think social prescribing creates a revolution in health, not just in health and well-being for people living in this country, but actually it creates a global revolution in health. I think we've got to embrace this now, because if you look at the global health challenges that we have as a society, we've got to find different ways of approaching that. And actually, a downstream crisis management health system is not going to work. It's not going to work for all of us. It's not going to work for people in our families. It's not going to work for our friends. We need to be properly investing in prevention. We need to properly invest in upstream support. So social prescribing then, what is it? Well, we all know it's about connection. It's about connection to community. It's about connection to things in the community that are going to help maintain our health and well-being. And I talk about 4 zones of social prescribing. So things in the arts and culture space, things about connecting to the natural environment, the opportunity of sports and exercise, and then advice and information and guidance. You know, these 4 zones hold all the keys to maintaining health and well-being. And we've developed at NASP an ecosystem of social prescribing. And if I can have the next slide up, this demonstrates just how social prescribing can operate across a whole society model. So at the core, we have social prescribing link workers who do amazing work every day, working intensively with those people who may need support, development of a plan, the opportunity of building their agency, building their skills, knowledge and confidence, and making connections to groups in an authentic and involved way. We also know that there's lots of people operating in communities that support those people who don't need that level of intensity, that may just need connecting, that may just need a bit of signposting, that may just need a helping hand to connect to their communities. And we know that there are people out there as well that actually could make those connections themselves, that already have that enablement to make those connections. They may have the means, they may have the connections already, but they don't necessarily know that those things are going to be good for them, that taking more exercise, that joining a community choir, that joining a walking football group, that getting out in nature is going to be good for them. So what we want to do is we want to really take this model out to society. We want to say, look, this is how we can transform health and well-being. This is how, as a nation, we can create this revolution in health by embracing this whole ecosystem, by supporting people effectively at all levels in society. And we need to, within that core level, we need to get behind those link workers. We need to ensure that we've got link workers operating in every primary care network across the whole of the country. And the 1,800 link workers that are already in place doing a phenomenal job, but we need more. We need to build this workforce that is going to really transform the way in which primary care works and transforms lives for people. And NASP is doing its own bit as well. And this next slide just shows you a little bit about what, as an organisation, we're doing. We've really embraced the opportunities of working with partners. And I wanted to thank all of our partners across the whole country for their support. That's partners that are working on the ground in local communities through our Thriving Communities programme. We've got 36 programmes across the country that have engaged over 10,000 people, working across all the zones of social prescribing, coming together with new and innovative collaborations. We've got an innovation programme where we're accelerating innovation at a national level, working with partners that are really investing in social prescribing to ensure that we can embed really positive activities in local communities. And we've also working with the World Health Innovation Summit, with the UN GSII and the World Health Organization on the delivery of a global social prescribing alliance. And I know that there's a number of people watching internationally now that are already part of that global movement. And it's fantastic to see that we've got a discussion later on the global social prescribing that's really taking shape across the whole world. So this is just a flavour of why social prescribing is important. For me, as I say, I think it represents a revolution in health and well-being. And I'm grateful to everybody for your support. And I'm really looking forward to working with you over the coming year, because I think we can really, really push this agenda much, much further and really transform lives. Thank you.